Good afternoon, everyone, and welcome to the National Center for Youth in Custody webinar, Preparing for Your PREA Audit, Lessons Learned from the Field. Before we get started, Callie Long with the National Training and Technical Assistance Center will go through some information that will help you if you have any technical difficulties. Callie?
Thank you, Pam. Good afternoon, everyone. My name is Callie Long-Murray, and I am with OJJDP's National Training and Technical Assistance Center. As your technical host, I would like to take a couple of minutes to discuss a few features of Adobe Connect, which will help you maximize your opportunity to participate in today's webinar. To download a copy of the PowerPoint slides and other important documents, locate the Handouts pod directly above the chat area. Click on the name of the file, then click the Download button. To send a chat message, type your message into the chat box. Hit Enter or click the message bubble icon to send. For those of you participating in today's webinar as a group, please take a minute and help us count. Go to the chat window and type in the total number of additional people in the room with you today. This will help us with our final count. Again, if you are viewing with a larger group, please type in the number of additional people joining you today. If you are viewing by yourself, there's no need to type anything at this time. At the conclusion of today's webinar, you'll be provided with a link to take a 5-minute online survey about today's presentation. We appreciate your feedback regarding this webinar. This information is used to assist in future planning and training. You will be able to access the evaluation link on the last slide of the PowerPoint. Finally, this event will be archived in OJJDP's online university at www.ojjdpou.org in approximately 2 weeks. Again, thank you for joining us today. I will now turn it back over to Pam.
Thank you, Callie. Again, welcome to Preparing for Your PREA Audit, Lessons Learned from the Field, the topic of today's webinar. My name is Pam Clark, and I'm a Program Associate with the National Center for Youth in Custody, or NCYC. NCYC is a National Training and Technical Assistance Center created by the Office of Juvenile Justice and Delinquency Prevention and coordinated by the National Partnership for Juvenile Services. The National Institute of Corrections also serves as a partner with the center. We're very pleased to have you with us for what will be an excellent and informative presentation today. In this webinar, our presenters will describe the PREA audit cycle, instruments, and key phases of a PREA audit and discuss how to prepare for the audit, hire an auditor, and what happens during the audit and period of corrective action. In this webinar, we'll focus on the following objectives. 1, we'll learn specific strategies for preparing for a PREA audit. 2, understand how to organize information for the audit. 3, learn about strategies for selecting and contracting with a PREA auditor. And 4, learn about the actual audit experience from the administrator of the first juvenile facility to undergo a PREA audit and the first juvenile or adult facility to be PREA compliant. Our first presenter today will be Ann Nelsen. Ann is a certified PREA auditor who has done a number of audits of juvenile facilities already. You'll find her bio and her photograph under the handout pod. Welcome, Ann, and thank you for presenting for us today.
Thank you, Pam, and I appreciate this opportunity. We will start. I want to start out today just by talking to you about the most valuable resource that you will have in preparing for your PREA audit, and that is the PREA Resource Center. The PREA Resource Center was created through a cooperative agreement with the Bureau of Justice Assistance and the National Council on Crime and Delinquency. And the best advice I can give you to start is bookmark their website because you'll be using it a lot. There is so much valuable information available to you on that website as you proceed to prepare for your audit and complete any corrective action or anything you have to do along the way. So with that, the first on the screen right now is the homepage of the PREA Resource Center, which you're going to be bookmarking if you haven't already. And to start out with your audit, what you want to do is go to the audit, click on the audit section at the top, And that's circled on the screen so that you can see where you're going to be going to start out your preparation for your audit. To start your audit, you're going to have to do a self-assessment. And that will be something you'll do way before you schedule your audit, before you contract with an auditor, and this will be the thing that will help you the most to get ready for your audit and to have a successful audit going forward. So again, go to the PREA Resource Center website, and you can get anything we talk about today there at that site. So, so keep that in mind. Then you want to search for Toolkit in the PREA Resource Center, but there are a number of toolkits. You want to select the one that's appropriate for your facility. If you run a juvenile facility, you don't need the jail toolkit. Review the entire toolkit because it has so much valuable information. It has detailed information that helps you to prepare for your audit, to help train your staff, and prepare your staff and other stakeholders for the audit process, including background on PREA and anything you might want to know. It's important and valuable at this stage to involve key members of your staff and those you consider to be part of your PREA team to help heighten their overall understanding of the entire audit process right from the very beginning. You're going to want to fill out the self-evaluation checklist, and that will help you identify what you already have in place and what you may need to create or tweak. This will take a lot of time. It's tedious and time-consuming, so allow yourself plenty of time. You're going to need to, for example, locate what policies you already have in place, and you're going to have to determine what policies you might have to revise or create to come into compliance with PREA standards. This will help you know what supporting documents you need to gather, and it also will take some research. You're going to have to examine, for example, what your resident education process is like, and does it comply with PREA standards, or does it need to change? You need to look at your admissions process, your staff training, all those kinds of things, and that will take time. So allow yourself time for all that. Also, as part of your preparation, you're going to be completing a PreAudit Questionnaire, again, also available on the PREA website. Plan to do this several weeks in advance of your audit, and I always recommend that you do that before you contract with your auditor so that you aren't crunched towards the end. You may be completely ready to fill out everything on the PreAudit Questionnaire, but you may run into something unexpected, and you don't want to having to be rushed, because the PreAudit Questionnaire will be provided to your auditor generally at least 2 weeks before the audit, but work with your auditor to find out how far in advance he or she needs that. Again, the PreAudit Questionnaire is available on the PRC website. Just click on Audit Instruments, choose Juvenile Facilities. The PreAudit Questionnaire has omitted some of the standards. We're not really sure why, if it's just an oversight or what, but when you are audited, you will be responsible for all of the standards. You will need to demonstrate to your auditor that you are in compliance with all of the standards, even if they're not addressed in the PreAudit Questionnaire. So be prepared to provide that documentation to your auditor as well. In compiling the documentation, what I've always liked, and I've requested from my facilities, is that the documentation be provided to me electronically. I ask them to send a thumb drive with the documentation of compliance for each standard and label those by standard. So as I'm going through the auditor compliance tool, I can find the information I need on the thumb drive by just looking at the standard number. There may be other methods to do that, but that's been very efficient and effective for me, and it saves a lot of paperwork for both the facility and for the auditor. Unfortunately, at this point, the audit instruments are still not fillable forms, although the PRC has been telling us that that will be happening in the foreseeable future. So hopefully that will happen soon for everyone. Okay, just in terms of getting things ready, you will need to, one of the major things you'll be working on is policies and procedures. That'll include layout, wording, dissemination, and training of those policies and procedures to your staff. And then you need, again, to have supporting documentation to demonstrate that your actual practice is consistent with the policies and procedures. It's a long list. This list on the screen of supporting documentation is far from inclusive, but these are good examples of the kinds of things that you'll provide copies of to your auditor, or your auditor will review while on site. Other documentation that you probably wouldn't provide to your auditor in advance might be things like viewing video monitoring, or something that is more difficult to provide on a thumb drive. So keep that in mind, and you might notify the auditor that you have additional documentation that's available for them to view on site when they're there to complete your audit. Again, this is a lot of information and a lot to compile, so plan ahead and begin early. Okay. Also, there are some specific standards that address information that needs to be on your website. So begin looking at that and see if your website doesn't yet include that information. It will need to be there for your audit in order to meet those standards. And again, to be completely PREA certified, you have to meet 100% of the standards. So if you don't have information on your website that's necessary and you do everything else, you're not going to be PREA compliant. If you're completing the survey of sexual violence that comes out from the federal government, you're already compiling most, if not all, of this information, and that provides a format for data collection for you to use. That does not include specific identifying information about youth, so you're covered there as well. Plan to provide information to your auditor. As you plan to provide information to your auditor, try to think like an auditor. Think, what would you need to feel confident that a standard is met if you were the auditor? That's an area where sometimes outside eyes can help you see things from an auditor's perspective, and a lot of facilities have done mock audits or abbreviated mock audits by using someone from the outside to see if they, in fact, can see what the auditor might see or not see in that process. It helps you to view things from the viewpoint of someone who's not familiar with your facility and practices. Okay, again, when you're developing policies, there's no set way to do this. What works for you and for your staff so that they can find the information they need is the best way to do it. But you need to address the standards in your policies, and sometimes that may mean addressing a standard in more than one place. What I've found is most facilities have developed a PREA policy that includes a great deal of the information from the standards, usually not all, but most of the information from the standards. And then facilities, in addition to that, also have other policies in place. For example, you may have a PREA standard policy that addresses issues around searches that are PREA specific, but you may also have a search policy that addresses all aspects of searches, both PREA related and non-PREA related. Use the standards as a guide in developing your policies. And one thing I have found is that as I've audited really good facilities that have very few examples to show me of PREA incidents, for example, they don't have any investigative reports or incident reports because there have been no incidents. It's reassuring to me if they address that standard in a policy, so I feel like their staff would know what to do if an incident did occur. So even if the standard doesn't require a policy, I like to see one in your policy manual. Okay. In developing your policies, some standards don't need much, do need more information than what the standard itself provides. You can't just cut and paste and use that standard. The standard on the screen is a good example of that. When an agency learns that a resident is subject to substantial risk of imminent abuse, it shall take immediate action to protect the resident. Well, an agency doesn't really take that immediate action. Someone takes that action. And action doesn't, this as a policy, a standalone, this won't work because I don't know what that action is. A standard is usually just a broad statement of expected direction and practices and desired results. Policies are similar to standards in that they usually don't contain enough specific information or instructions to be used by themselves, but procedures include the detail your staff need. Procedures include the who, what, where, when, and how information. Cutting and pasting wording out of the standards into your policy can be done, but that normally does not give you enough procedural detail to instruct your staff on how to meet the PREA standard or to meet your policy. And again, this is one example of that. This standard needs much more detail to provide the necessary procedures for staff to follow. if this were used alone, this would not be enough information to instruct your staff on what they need to do and what they have authority to do. Additional information that might be included would be information on room or dorm change assignments, classroom changes, extra staff escorts, schedule changes, and things like that. However, there are some standards, and this is one, where the standard can almost stand alone as your procedure. Sometimes it's specific enough, and you may not need to add much. And in fact, every point in this subsection could be in your policy and procedure. This standard subsection pretty much does give you the who, what, where, when, and how that your staff will need to know in following and then complying with the standard. So if you can analyze your policies like this as you're writing them with a high level of scrutiny ahead of time, you'll be much better off when you're sitting with your auditor and they're doing that same kind of scrutiny. Also, this will help your staff be more prepared because most of the time the auditor is in your facility, he or she will be interviewing staff randomly selected or youth randomly selected and asking questions about what happens in particular situations. If that information is in the policies and the staff know the policies and the practices are consistent with the policies, you should be fine. Okay, the other thing you're going to need to do is have definitions in your policies and procedures. The PREA standards include two different kinds of definitions. The first definitions are found in section 115.5, and those are the general definitions. For example, one example of a general definition is the definition of agency. These definitions you can actually tweak or revise to make them more effective and more useful to you at your facility. For example, the definition of agency is a lot of bureaucratic wordage. And so agency means the unit of a state and local, corporate, or nonprofit authority or of the Department of Justice with direct responsibility for operation of any facility that confines inmates, detainees, residents, including the implementation of policies as set by the governing corporate or nonprofit authority. Don't memorize that. In my case, I'm from Utah. Maybe a more useful definition of agency would be agency is the Division of Juvenile Justice Services, which has responsibility for operation of all juvenile facilities in the state of Utah, including the promulgation of policies. Also, there may be some definitions in the general definitions you may not even need to include in your policies and procedures. If you run a juvenile detention center, you probably don't need to include the definition of jail in your definition. In fact, that may just add confusion to your staff. On the other hand, the other kinds of definitions are the sexual abuse definitions found in section 115.6. Those need to be in your policy and procedure manual exactly as they are in the PREA standards. Those can't be changed, those can't be tweaked, and you can't leave any of those out. Okay, so once you've got your policies and procedures developed, you need to disseminate those to your staff. Your staff need to know them. They can't have just one manual kept in the superintendent's office that nobody ever reads. Make sure you include the policy issue date. You have documentation of the training and provide that documentation to your auditor. And that includes not just that they received the policy, but they understand the policy as well. And also make sure you document the policy effective date. It's not uncommon to make a policy effective and then hurry and train your staff, and there's no rules that say you can't do that, but ideally you want to make the policy effective after all of your staff are trained. Then keep in mind, you might have the best policies in the world, but when the auditor interviews your staff and your staff aren't familiar with the expectations spelled out in those policies, you're going to have problems. So make sure that your staff are familiar with your policies. The same thing is true for resident education. The resident education standard 115.333 spells out what is required and what needs to be included here. Keep in mind, resident education needs to be age appropriate. It's not something that's written for your college-educated staff. and a very detailed PowerPoint may not be sufficient for a youth to really understand the information being shared. There are some good videos out there, and you might contact colleagues around the country and see what they're using for their resident education. Again, keep record of the resident education to provide to your auditor, and keep in mind there are 2 separate sessions that need to be provided. Resident education must be provided during the intake process and again within 10 days of intake, either in person or by video. And once again, remember, your auditor will be interviewing a great number of randomly selected residents, and if the residents aren't able to answer the questions about the education they received, then that will, again, reflect on the quality of the education and your ability to comply with this standard. Related to that is the staff training on PREA issues in general. Standard 115-331 lists 11 specific topics, and you need to be able to provide documentation to your auditor that you train on all 11 topics. Provide your auditor with the curriculum as well, so that the curriculum has, so that the information your auditor reviews doesn't just say training on this, on PREA, but it also includes what that training was, including all 11 topics, and that your staff understood that training. Again, staff will be interviewed and questions will be asked about all of those 11 topics. If your staff aren't able to respond to those questions, it will reflect back on your ability to come into compliance and meet that standard. Okay, remember, a PREA audit includes 3 distinct stages. A PREA audit does not just include 3 days on site and you're done. The pre-audit work is very intensive, and that involves, that's when your auditor will be going through the PreAudit Questionnaire and working on completing the audit compliance tool. And that's when your auditor reviews the documentation that you provide her and prepares for the on-site part of that audit. The audit itself can be a stressful but very rewarding process. That's an acknowledgement of all your work and preparation. And then the post-audit phase includes any corrective action that you may be expected to do. Keep in mind every auditor is different, and there is a difference in how things are interpreted. A corrective action plan can actually be a helpful learning process, and it will help you continue to improve with your quality improvement process. And if you're part of a multi-facility agency, the corrective action plan for one facility can help other facilities prepare for their audits. For the post-audit, you'll be working closely with your auditor. Please be sure to maintain regular communication with your auditor. Don't wait until you think you have successfully completed the corrective action plan and submit the information and then find out that that's not what she wanted. Clarify as you go along. Okay, so lastly, the audit cycle includes 3 years. We're currently in the second of the 3 years of the first audit cycle, and the first audit cycle ends in August of 2016. I certainly want to commend all of you for taking on this huge task, and particularly those of you who may have worked on completing an audit or preparing for an audit during the first year of the cycle. I think we'll be taking questions if you have them at the end of the PowerPoint, or at the end of the webinar. So I will now turn my time over to my colleague, and he can talk to you about how he prepared for his audit specifically. Thank you very much.
And thank you so much for covering a huge amount of information in a very short time. We really appreciate that. So Anne has talked generally about what the PREA audit looks like, what you need to be doing. Now we have the opportunity to hear from Steve Jett, who is the administrator of a 90-bed facility, the Southwest Idaho Juvenile Detention Center, and he is also a certified PREA auditor. Steve has been through the audit process and can share his personal experiences with that process. Steve, thank you so much for being with us today, and it's all yours.
Okay, thank you very much. I hope everybody can hear me. I've been the administrator of the Southwest Idaho Juvenile Detention Center since 1993, and Just a little bit of information about the facility. We have 90 beds. Our population now is running in the 30s. We serve 6 counties in southwest Idaho, which some of those counties contain more antelope and mule deer than people, but it's a nice place. Anyway, the center has been preparing for PREA for quite a while. In 2005, we first heard about the PREA Act. We didn't know much about it. We invited the state's adult PREA coordinator, Lori Brisbane, in to talk to our juvenile detention administrators and to tell us a little bit about what PREA was. At that time, everybody knows that there were no standards promulgated yet. So Idaho actually put wording into our standards for our state juvenile, or excuse me, or for our regional juvenile detention centers in 2007. We really didn't know what the final standards would be, but we did put in there increased training for staff, multiple avenues to report, and some other things that we anticipated would be in the final PREA standards. So the training that went on in our detention center first was general red flag training, boundary issues, and things like that that were common sense things. So when the standards were finally released in 2012, we had quite a few things already in place. Now, I was invited to go to the first auditor training class in June of 2013. And while I was there, one of the faculty members expressed a desire to have a juvenile facility audited prior to the second auditor training class. And so I felt that my facility had been working on PREA for a long time, and so I volunteered to be the first juvenile facility audited. One of the other motivating factors is that I knew the audit would set firm deadlines that we would have to finish our work rather quickly. So as a result, I contacted, at that time, all of the potential juvenile auditors, and at that time there were only 9. They had been through the class with me, and even though we hadn't been formally certified yet, I knew that that group would be, someone from that group would be my auditor. So I asked them for a proposal. I received 3 back, and that's how we hired our auditor. I'll talk a little bit more about hiring an auditor in a couple slides, but that's the reasoning behind my desire to get an audit quickly. So to back up a little bit with our policies and procedures, Ann covered some of this well, but we did start with the PREA standards as our roadmap. If you look at my policy now, it starts at 311 and goes all the way through to 389. And I found that that was it was easier for me to do that, and also the auditor was able to follow things and find things easily. We did pretty much what Ann said, took the standards, sometimes took the wording right out of the standards, and crafted our policies and procedures, and then the wording from the standard that we didn't need, we deleted. So my main PREA policy covers everything that wasn't already covered in other policies. Like searches is something that I already had a policy about. So I didn't want my procedures from searches to be fragmented, so everything about searches was kept in the search policy. Everything about admissions was kept in the admission policy, and the overall PREA policy covered everything else. So we thought we were ready. So then we went and requested an RFP, as I mentioned, to hire our auditor. But there are a couple other ways to do it. On the PREA Resource Center website, under the same tab that Ann showed you earlier, Audit, there is a link to get the list of certified auditors. So you can click on that. You can screen for the type of facility that you want to be audited. Well, most of you are probably looking at juvenile facilities. And then you can select an auditor from the list and contact them directly. You can pick an auditor that's close by, or you can pick an auditor that you may be familiar with or have a recommendation for. Or, as I mentioned, you can undergo an RFP process. If you contact the PREA Resource Center, they will send an announcement out to all the auditors if requested. So if you want to contact a lot of auditors for an RFP, that's the way to do it. The PREA Resource Center will help out by forwarding your announcement out to everybody. So they're very helpful that way. After you enter into negotiations with the auditor, you'll have to have a contract. And in that contract, you'll have to cover all the details. Scheduling, costs, and fee structure need to be outlined. Travel, lodging, transportation arrangements. This will all be in the contract. Now remember, once the contract is signed, the clock starts ticking. Ann mentioned earlier that some of the things that you'll have to do take some time. Doing research on the number of residents that were given the resident education. You'll have to do research on the number of intakes, and so on. So you want to do that ahead of time. It's helpful to do that. I'll talk a little bit about the cost of a PREA audit. I won't go into too many specifics because there are too many variables to try to cover this. But the considerations, of course, you'll consider the auditor's fees. There's a few estimates with the audit. It's estimated that the pre-audit document review will take an auditor 2 to 3 days. The on-site time is estimated at 3 or 4 days. The post-audit work on the auditor compliance tool leading up to your initial report is estimated to be 3 to 4 days, and I found that to be fairly accurate in the audits that I've performed. Also in the costs will be all the expenses, travel, lodging, per diem. The travel cost is one factor that you'll want to take into consideration, and you may look at contacting an auditor that's close by to cut down on those fees. Corrective action work is something that an auditor will probably have a hard time estimating prior to actually doing the audit. We, as auditors, do not know how much is done, and also, as a result, how much still has to be done. So the corrective action work may not be estimated ahead of time. Some auditors may choose to do a flat fee audit, which will cover their costs for the corrective action work. So they are all things that you will need to talk to your auditor about prior to entering into the contract. During the pre-audit phase, remember that the audits are facility level audits, not agency audits. And so if you run a state facility, the auditor will be looking at your facility only, not an overall agency audit. However, there's some agencies with multiple facilities that can provide some information for the audit that the individual facilities can't provide, including things like contracts. So the auditor will provide the PreAudit Questionnaire for agency-specific information. Now, the auditor has to provide the facility an official notice that they must post roughly 60 days in advance of the site visit. And that will include the auditor's contact information so that staff or residents can contact the auditor and talk to them while they're on site. Just a side note, one of my facilities that I audited, they posted the notice, and I did have a juvenile call me. So it does work. That posting will need to include dates that the audit visit will occur, the purpose of the audit, of course, and who to notify at the facility to speak with the auditor, and then also the name and mailing address and phone number of the auditor. The PreAudit Questionnaire, again, this is on the PREA Resource Center's website under the Audit tab, and you'll go to Audit Instrument, and there's a list of files in the Audit Instrument that you'll be able to download. The PreAudit Questionnaire is one of them. Again, we recommend that you fill that out ahead of time because there's a lot of research. If you wait till you get a contract with an auditor, the clock is ticking and you don't want to be under the gun for meeting strict deadlines. So leave yourself plenty of time. And also make sure when you do that search that you get the correct PreAudit Questionnaire and the correct audit instrument. Ann mentioned this earlier. There are some differences in the adult standards and the juvenile standards, so please get the right PreAudit Questionnaire. At that time, when the auditor provides the questionnaire to the staff, then the auditor works with timelines and starts to gather information. It's recommended there is at least 6 weeks between the receipt of the questionnaire and the on-site portion of the audit. They estimate that it'll take about 4 weeks to complete the questionnaire and then submit it to the auditor. The auditor will take about 2 weeks to review documents and have any questions answered by those at the facility. I've been asked this question in audits that I've done, and I asked my auditor the same question: how much do you want? Now, you can upload documents or send them to the auditor in a jump drive or a thumb drive. At the time I had my audit, we exchanged information through email. A lot of files were transferred that way, and we did not use a jump drive, thumb drive, or a CD. All of the documents as far as policies will need to be submitted. Other things, such as supporting documents, there may be a sample sent to the auditor ahead of time, but the auditor may still look at and confirm more of those documents when they get on site. For example, if I have 100 contractors that I've trained, I don't know if the auditor will want to see all 100 sign-off sheets, so I may send a sample. When the auditor's here on site, she looked at all of my contractor training records. So these are all things that will need to be worked out with the auditor prior to the audit visit. Again, the auditor will have some discretion, and they will provide the PREA coordinator, compliance manager, or administrator how much documentation needs to be sent. Also, in the audit instrument, there's a checklist of documentation. That publication will give you guidance as far as what the auditor will be looking at to determine compliance or non-compliance. As a general rule, the auditor will need to see documentation from the past 12 months. So that should be sent to them. Again, the auditor may allow a sample prior to the audit visit, and we'll possibly check all the supporting documents when the auditor gets on site. So the bottom line to remember is the auditor must be convinced that the activity is compliant with the standard. Auditors are looking for systems that are in place. Ann mentioned that some of the facilities that she has audited did not have a lot of incidents to review. Therefore, we really, as auditors, like to see policy. And I think as administrators from the other end of the spectrum, I think it is important to have policies in place to make sure that all of these practices continue uniformly across the facility. Again, communication with your auditor is very, very important. My auditor contacted me very often, and I contacted her, and we had very good lines of communication open. So, The next phase was the audit phase, and when my auditor arrived, the first thing we did was a facility tour, and that is a requirement of the audit visit. There are instructions and guidance for conducting the tour in the audit instrument, so be familiar with that. At that time, she also did additional document review and conducted staff and resident interviews. There's also guidelines as to who will be interviewed. There are some specialized staff interviews, including the PREA coordinator or compliance manager, depending on your situation, medical and mental health staff, and staff members that handle the intake assessment. There's also some guidelines as far as resident interviews. If any resident identifies as being LGBTI, or if any resident has actually reported a sexual abuse allegation, those individuals should be interviewed as well. Also, at the time of my audit, the auditor visited with our community service organization. And this deals with the MOU that has to be in place for emotional support and victim advocate. So also she called and talked to our investigator from the local police department. It's at the audit visit that the auditor starts to fill out the auditor compliance tool. And this is the very extensive document that the auditors will use to document their decisions. And that auditor compliance tool serves as the basis for the summary report, the initial report, and the final report. I already talked a little bit about that, the people to be interviewed, and there's a list of individuals that must be interviewed during the audit. After the audit visit, the post-audit phase starts, and the summary report is issued 30 days after the audit visit. And I found that during that phase, I communicated quite a bit with my auditor to answer questions that she still had. That was very helpful. While filling out the auditor compliance tool, there's a response for each standard, and the auditor needs to justify the determination that's been made, why something was found to be in compliance, and also why something was found to be out of compliance. There are 3 determinations for every subsection, and I'll tell you that 2 of them are good and 1 not so good. The auditor may find that you exceed standards or meet standards, or they may also find that you do not meet standards. And for those decisions, justification has to be illustrated. If there are any standards that you're found to be not compliant with and does not meet standards, then a corrective action period starts upon the receipt of that summary report. And as we were practicing for this webinar, I mentioned that that clock really goes fast. And you'll find that is true. The 180-day corrective action period will go quickly. During this time, the agency and the auditor shall jointly develop a plan to achieve compliance. Now, the auditor knows what has to be done, what has to be the final result, but it's usually the agency and the facility administrators and compliance manager that will figure out how to get this done. So they need to work together and come up with the corrective action plan. After that 180-day corrective action period, the auditor has 30 days to issue the final report. Now, I will add that the corrective action period does not have to take the entire 180 days. If you are able to get your corrective action work done, completed, submitted to the auditor, and the auditor evaluates it, your corrective action period may be shorter, may be much shorter, but you do have 180 days to finish the work. And Ann did mention this earlier, that this type of audit is not complete at the end of the audit visit. This audit process, through this audit process, we really try to bring you into compliance. The auditor will work with you to come up with a corrective action plan and help you along the way. So it was a very, very good experience for me. Now, the final report has to be published on your website. And the standard says that it must publish this on your website if it has one, or if it does not have one, make the publication available through other means. So if you do have a website, it will have to be on the website. If you don't, then you'll have to make your final report available publicly in some other fashion. If an agency doesn't meet all the standards, they can request another audit once they believe they have achieved compliance. There's also an appeal process. If the agency does think that they are in compliance and doesn't agree with the auditor's decision, they may file an appeal within 90 days of the auditor's final determination. So if the Department of Justice does determine that there is a good reason for that reevaluation, there may be a re-audit. Remember, the agency does bear the cost of that re-audit. The final determination of the re-audit cannot be appealed. Okay? And remember, the process and compliance measures for the reevaluation are going to be the same for the actual audit. As I was, when I received my final report, I elected to publish the entire auditor compliance tool, and I did that for one main reason. The final report that the PREA Resource Center gives to us does not have a lot of information in it, but the auditor compliance tool does. I published my entire auditor compliance tool so that those who want to be compliant, want to see what we had to do, can look at it. So my final report is available on my website. There's the address there. It's www.canyonco.org/SWIJDC. When you get to that page, on the left-hand side, there is a link for, it's labeled Compliance with Prison Rape Elimination Act, and you can click on that and see my final report. You can see my policy and several other things that are out there. One of the things that Ann mentioned at the very beginning of the webinar was the resources. And I will echo what she said. The PREA Resource Center's website is a very, very valuable tool. It has so many resources on it that will help you along the way to get PREA compliant. There's also the National Center for Youth in Custody. The Washington College of Law and Silence Project is also a good resource, and Just Detention International. Those resources have so much information, it's impossible to explain it all. But the PREAResourceCenter.org website is where you'll find training materials, examples of MOUs, webinars, and all kinds of different things to help you get compliant with the PREA standards. So at this time, I will turn the show back to Pam.
Thank you, Steve. You and Ann both provided great information, but I think it's really helpful to hear from someone who's actually been through the audit process and has had to address all of the requirements under PREA. So thank you for sharing that experience. We do have a number of questions. They're not really designated to either one of you individually, so I will put the question out and you will both have an opportunity to answer, or one of you might defer to the other one. So the first question that came up is around whether the standards are the same for adult and juvenile facilities. Would one of you like to address that question?
Sure, I can. The standards are similar, but there are differences. Some obvious differences are that the adult standards have 115.14, a youthful inmate standard. That is not found in juvenile facility standards. There are some other small differences. I believe there's some differences in 381 and 383 for medical and mental health, and a few others, but they are a little bit different.
Steve, there was at least one person asking if there was anyone on the webinar who was with the Juvenile Assessment Center. Can you speak to how the standards apply to a center that is not really, or whether they do, a juvenile detention center, but is merely an assessment center?
Does the center hold residents overnight?
I can't answer that question,
Okay.
so can you speak to if they do?
I think since there are so many different factors, I would direct them to the PREA Resource Center's Frequently Asked Questions page. I hesitate to try to answer that because of the many, many different formats that different assessment centers have.
Great.
And
I think
I
that's
would echo that too. I ran a juvenile assessment center for a few years, and it was a 45-day residential facility for delinquent youth. So it would probably come under the PREA standards, but it wasn't. It was staff secure, not building secure. But I think it would come under the PREA standards. But that was clearly it was a 45-day facility versus maybe something that might be very brief. I think there are other factors, and the PREA Resource Center again is your best source of information on that.
Right.
Great, and I don't think we can say too often how much information is available at the PREA Resource Center website, and the FAQ page will address many things that may not be quite as clear in the actual standard itself.
Yes.
The question came up about what does MOU mean, and it was generally answered that an MOU is a memorandum of understanding. But could the two of you talk about who you might want to have MOUs with and where they might find some sample MOUs that they can use?
Sure.
I think that was discussed somewhat in the chat box, and Steve, for one, volunteered to provide a copy of an MOU, but also I noticed in the chat box, David Gaspar pointed out that there's a sample MOU on the PREA Resource Center website. I think a sample, and Steve, you can come up with other suggestions, an example of when you might have an MOU might be with your rape crisis center or sexual violence center, whatever it may be called in your community, to provide crisis services to your youth. You might have an MOU in place when you don't necessarily need it to be a full-fledged contract, but it's kind of a step below a contract, but it spells out what each agency is responsible for, and generally doesn't require the exchange of money.
Right.
Great.
I agree.
Who else besides a domestic violence shelter or service provider might a facility want to have an MOU with under PREA?
In some cases, I have heard of MOUs with local law enforcement agencies and prosecutors, also with local hospitals, so that sex abuse forensic examiners and sex abuse nurse examiners are used if there are any victims from the facility that are taken to the hospital.
Great.
That's what I can think of offhand.
You may also
Great.
have an MOU with a community provider to provide either crisis or follow-up counseling to a victim of sexual abuse in your facility.
Okay, great. Thank you. Steve, I think you talked about, the question came up, what if you don't have a website? And I think you addressed the fact that there still needs to be public access to the results of the PREA audit. Do you have any examples of how a facility that doesn't have a website might go about making that report publicly available?
You know, it can be done in, I guess, several different ways. Providing a copy of the final report in the lobby would be one way. Publishing it in the paper, putting it in the county courthouse. So someone could be creative and publish it, but if the facility has a website, it has to be on the website. So it's a relatively easy thing to do if you have an IT department.
Right. Anne, would you add anything to that?
No, I have not conducted any audits so far for any facilities that don't have websites, and given how simple it is to develop a website nowadays, that may be something that, you know, the PREA standards might prompt a facility or an agency to develop a website if they haven't one already.
Good thinking. Okay, the juvenile audit tool asks if the resident's risk level is reassessed periodically throughout their confinement. How often is that? Is there a specific frequency requirement? How often is that, and when?
Well, the standard says that assessment must be done within 72 hours of the resident's arrival and periodically throughout a resident's confinement. So the standard is actually vague. And I think it would, you would have to take into consideration your average length of stay in determining that. If you have, my average length of stay is 14 days. So for the most part, they're gone relatively quickly. But if I ran a state correctional facility whose average stay was, say, 18 months, there are probably programs that are reviewing the youth and their progress on a regular basis. But as the standards are vague, there's no real guidelines.
And I would agree with Steve. I think it depends on the length of stay, but if you do reassess, for example, in a longer-term facility, I think it's important that you be consistent so that you're not, you have a minimum length of time that every youth is reassessed, and some may be reassessed more frequently if there are particular issues that you're concerned about.
So it sounds like you're recommending a policy that dictates the frequency with which that needs to occur for residents in general.
Right, and I'm not aware that there are any FAQs on the PREA Resource Center about this. That might be something to look up, but I just think just for it's best practice that you have something consistently in place and are not risking any accusations of treating different residents differently without just cause. I mean, you could probably reassess more often, but don't reassess less often than a set amount of time.
Thank you. We had a question. You both referred to the clock starts ticking. What do you mean by the clock starts ticking when you sign the contract?
I can speak to that. I entered into a contract and we set a date for our audit. I think our contract was signed in August, and I guess it was a little earlier than that, and our audit started in September of 2013. So once you have nailed down your audit visit date, and that's your deadline, and you have a lot of work to do. That's why both Ann and I strongly recommended getting the pre-audit questionnaire or the PREA toolkit if you're just starting out, and getting that done early so that you're not up against a deadline that you might not be able to meet. So that's what we mean. When you get everything in place, it'll come along pretty quickly. And the 180-day corrective action period will go rather fast. So jump on these things early and get them done.
Ann, I think you suggested completing the pre-audit questionnaire before you even put out the RFP. Was that correct?
Well, at least before you contract with your auditor. You could be looking for audits. And, and Steve said, a common way to select an auditor is through an RFP. But there have been situations, too, for both Steve and I, where we have been contacted directly based on, information that the facility has about us or something. So that's something that is facility specific. But at least before you contract with your auditor, complete the pre-audit questionnaire. Isn't that what you were saying, Steve?
Yes. Strongly recommend that.
Okay. Thank you. There's another question. Does OJJDP provide any assistance in helping pay for an audit? Small facilities are not funded for that expense, like an adult, for the expense of an audit like this.
I believe that one of the last grants could be used for audits, and that was through the PREA Resource Center. But I'm not sure that money's still available. So I guess I probably can't answer that question.
I think I was told that Alyssa Rumsey is on the webinar today, so if she has any thoughts on that and could type a response in the chat box, that would be very helpful for people with that question. Another question, one person says much of our documentation is done on an electronic information system rather than on paper. How is this handled with the audit?
With much appreciation. Ann brought this up. We would rather have electronic information sent to us than a giant pile of papers that we have to go through. And so whether it's policies or logs, logbooks or activity logs, or educational or resident education sessions, their participation is kept electronically, we can handle that. In fact, there is a program out there now that is supposed to help with the pre-audit. I haven't seen it, but I welcome the opportunity to work with facilities that have more along the lines of electronic information than paper.
The only thing I had a question about this question, and I may not have understood it correctly. If this person is asking that their information is all in the computer at the facility and cannot be downloaded to a thumb drive or jump drive or a CD or something and sent to the auditor, if that's the case, that information would need to be reviewed by the auditor on site. And I think then that would be addressed in your contract. The actual on-site audit would probably take longer. The pre-audit preparation may take a little less time. But the auditor still needs to go through that pre-audit questionnaire and the auditor compliance tool prior to the audit, even if they don't have the documentation. So it could be duplicating their time. And again, I may have not quite understood what this person was asking. If it can be provided electronically as opposed to boxes of documents, auditors will love you for that.
No, I think it was helpful that you, between the two of you, you addressed that question whichever way the question needed to be interpreted. So thank you, Ann, for adding that for us. I have another question. What role does the educational director have in all this?
I can speak to that. Standard 364, 115.364, subsection B, says that if the first staff responder is not a security staff member, the responder shall be required to do a few things. So it's very possible that a teacher or a nurse is the person that the resident feels comfortable in reporting to. So there has to be training for the teachers. There has to be training for medical staff. In fact, 335 deals with that. So teachers may be the first responder, the person that the juvenile reports to. They need to know their responsibilities, especially under Standard 364. So they do need to be very well versed in PREA, especially how to handle reports and how to handle the resident that just reported to them. Again, in 364 there is 4 subsections under subsection A that give specific instructions on how the first responder needs to act, and teachers as well need to be trained in that.
Also, depending on how your facility is staffed, your teachers may be employed by you, which raises them to a little bit higher level of responsibility, but not a lot, or they may be contractors. But either way, your contractors also have, contractors and volunteers have specific requirements in the standards as well. So even if they are not your employees, they still have certain requirements that they need to comply with and certain training they need to complete.
Okay, thank you. What exactly are the potential consequences for a facility being found lacking in one or more areas in the PREA audit?
Well, you don't achieve PREA certification. Like I said earlier, the PREA certification requires 100% compliance with all of the standards. And there are some situations where a particular standard is particularly difficult to achieve, maybe based on the organizational structure of the agency or some other factors that the facility has limited control over. And I think your auditor will certainly want to work with you and help you figure out ways to meet all of the standards, and work with you and maybe your stakeholders if necessary to help you come into compliance. Steve, can you think of any other?
With consequences?
Mm-hmm.
Yes.
Now, if your facility falls under the direct control of the governor, then your state may have consequences for noncompliance, and that's spelled out in the Act. That's 5% of the grant money coming to the state through BJA. So that may be another potential consequence. There are other consequences if you are a private agency and you contract for holding kids. If you are not PREA compliant, the state agency that contracts with you may cut your contract. So there may be some significant consequences depending on your situation.
Thank you. Another question, if the Juvenile Assessment Center does not hold juveniles overnight, do the PREA standards apply?
I wouldn't.
Again, no,
Yeah,
but I would
consult
direct
with the PREA Resource Center, wouldn't you, Steve?
Yeah, I would. Yeah, that's a difficult one, and I've had many questions asked in trainings throughout the last couple of years that I would direct everybody to go to the PREA Resource Center's Frequently Asked Questions website.
Or they could make a direct inquiry to the PREA Resource Center, could they not?
Right.
Yes. In fact, if you go to the Resource Center's website and have questions, you can use the Contact Us link on the homepage, and they have responded real quickly. So.
Great. Thank you. Steve, I think you responded to this question in the chat box, but it was really for both of you. Are either of you noting any trends in the audits that you've conducted so far?
The only trend I have seen is that it seems like the facilities that have completed audits, particularly in the first year, are really good facilities. I've been very impressed, and that's not a surprise. You know, the facilities that are most ready to be audited the first year are more likely to be facilities that have been operating successfully and safely already.
Okay.
And I would add that the agencies that or the facilities that I have audited have been really different in format, and so I don't think I can identify any real trends.
Okay, thank you. I have one last question here, unless something comes up before we finish. Do the posters or the announcements, the notice announcing the PREA audit, do they have to be posted 6 weeks or 60 days before the audit? The questioner has seen different dates on the process maps and different lengths of time.
I have too, and I apologize if I had a discrepancy in the slides here, but I have heard 60 days. And
60 days. And is that your understanding as well?
You know what? I've heard both also. So, you know, that may be another one of those questions for the PREA Resource Center. I don't know if there's an FAQ on that, but, you know, if in doubt, I'd go with 60 days and you're going to be covered in the meantime.
Okay. Okay. We have a couple more questions coming up. I do want to say that Dave Gaspar has said that the standards apply to residential facilities only. So if a juvenile assessment center does not hold youth overnight, they should not be required to comply with PREA. However, I would take Ann and Steve's suggestions and I would ask my question directly of the PRC. To be PREA compliant, does a facility have to have video monitoring?
Actually, no, but there are a couple standards that address that. The first standard is 313. 313D talks about, 313A and 313D talk about assessing the facility's deployment of video monitoring systems. And 318 talks about any upgrades to facilities and technologies. So when considering a video monitoring system, when you're installing it or updating it, then the agency shall consider how that technology may enhance the agency's ability to protect residents from sexual abuse. I have had facilities that do not have video monitoring that I felt were very safe. I've also been in facilities that have video monitoring that may not have been as safe. But when considering installing or updating what technology you might have, then consider how that will affect your ability to keep the residents safe.
Thank you. I have been through the PREA certification training, and my greatest recollection on video monitoring was if you walk through your facility and you can clearly see blind spots, areas where it would be very difficult for staff supervising residents to see them, that's an area that you should probably consider some video monitoring.
Right.
I have one last question. Would attorneys visiting residents in a facility be required to have PREA training?
As they're not a contractor, they may not. However, as a facility administrator, the attorneys that come in do sign a small sheet that says if anything is reported to them, they have to report to us immediately, and we do have a zero tolerance policy.
Okay. I do have, there's one more thing. It's more of a statement than a question, but I think you might be able to provide some insight. One of the listeners says, we have a program that does not house youth overnight, but they do provide education, and they're being required by their oversight agency or referring agency that they need to comply with PREA. Would either of you care to respond to that?
Sure. Even though the PREA standards may not apply to you just by what the PREA standards are designed to do, if your oversight agency is telling you that you need to comply, and therefore I suspect that will affect your license and your ability to get contracts, then really you have no choice. That's a decision that's being made for you. And I think that even with your program, no matter what it's like, having reporting ways to report, multiple ways to report, being trained on your state's mandatory reporting laws, having in place sexual incident review teams, and all the things that PREA has in it, I think will make your program a safer program. So if your oversight committee or oversight agency is saying that you need to, I would I'd strongly suggest that contact the PREA Resource Center for help.
Great. Thank you both very much. It appears that was the last of our questions. I think it's been very helpful to have the information provided and the ability for questions to be answered by Steve and Ann. Their experience has contributed a lot to this topic. This session will be archived, I think Callie mentioned this before, at OJJDP's online university so that you can go back and listen to anything or look at the slides again if you wish. For more information, you can also contact the Office of Juvenile Justice and Delinquency Prevention, OJJDP's National Training and Technical Assistance Center that has hosted today's webinar, and OJJDP's National Center for Youth in Custody that coordinated this webinar. Please stay online long enough to get the online evaluation and complete that. Your feedback is critically important to us in planning future webinars and in coordinating training efforts. Thank you so much. Again, Michelle sent a reminder. The PowerPoint is available in the handout pod as well as information on your presenters. Thanks for joining us today. Our next webinar will be on February 18th